When COVID-19 broke out, Uganda found itself at a crossroads, with the pandemic causing long-lasting problems. With a doctor-to-patient ratio of 1 to 25,000, the virus swept across the country like a wildfire, infecting over 200,000 people and claiming over 3,000 lives. The health system was overwhelmed, the economy was crippled, and people were fearful and hopeless. Families were torn apart, businesses were shut down, and schools were closed. People suffered in isolation without adequate care or support.
I had to sensitize my community about the prevention of COVID and how are they going to prevent themselves from COVID. They should wash their hands, they should keep the social distance.
There were numerous difficulties. It took days for sample results to arrive, and health personnel lacked critical safety gear like masks, gloves, and even other kinds of kit. This made it difficult to trace contacts of the infected people, and the virus quickly spread. To respond to these problems, USAID collaborated with the different stakeholders to bolster the country's preparedness infrastructure by establishing Emergency Operation Centers, EOCs, also known as Emergency Coordination Hubs, district task forces, and lab hub networks. A key lesson from the COVID-19 response is that in times of crisis, coordination and response are vital. The COVID-19 Situation Room in Mbale transitioned into a regional coordination hub for health emergencies. With USAID support, the 6 other emergency coordination centers across Uganda in Gulu, Lira, Jinja, Mbarara, Kabale, and Moroto, in addition to the one in Mbale, are established and functional.
While we were working with the team for USAID, we had vaccines that were nearing expiry. So they supported us to create demand for the vaccines first and deploy staff.
Mbale EOC came in handy to support on tracking of these samples. They've helped us to track these samples and ensure that they are relayed to the relevant laboratories in time, and then they also relay the information to our teams.
And that has helped us in the early and fast detection of events that are reported from the district.
We are able to control the problem at source. By doing so, you are minimizing the cost of human suffering, the cost of the disease in terms of resources needed.
These EOCs are now identifying other outbreaks in the community, such as anthrax, Marburg, Ebola, malaria, and Rift Valley fever. There is mapping of infectious and non-infectious diseases and other risk factors like floods and mudslides.
We had anthrax case in Quen. We saw the VITs flagging it out. So those are the response structures that we're able to see. And we're now able to analyze and utilize data timely.
If you are providing the risky communication, we use different people in the One Health system, that is a veterinary officer and also the RDCs.
We do have this rapid response team in place. It is a standby team that in case of anything, they are always prepared.
Turnaround time has improved because we go to the field, we pick the samples, package it, triple packaging, then we transport it to Kapchorwa Hub. Then we alert Mbale EOC to make a follow-up.
Availing the district with enough transport so that we are capable of reaching each and every part of Mbale district without constraint.
As of June 4th, 2023, Uganda had achieved substantial progress in its COVID-19 response. Over 20 million vaccine doses were delivered to Uganda by the US government, and vaccination coverage increased. More than 7.6 million vaccine doses were delivered to people's arms through USG support. As of September 2023, over 12 million of the population over 18 has been fully vaccinated. As of December 2022, over 21,000 health workers had been remunerated for COVID-19 vaccine delivery between October 2021 and December 2022.
We sensitize our community, sensitize them on hygiene and sanitation, the benefits of going to the facility when they are sick.
USAID has never left out the leadership of the district, and sustainability has been there because of that.
And there is need to conduct simulation exercises from the district level to the regional level to be able to test a regional EOC capacity to be able to effectively respond. And it is also the requirement of the WHO authorized conduct simulation exercises and tabletop exercises.